Hi everybody. I'm going to be doing a video here for my lovely mother who is suffering from trigeminal neuralgia, and I'm putting this together for her. So here you go, Mom. My mother has really worked with trigeminal neuralgia for a couple years now, and it was very, very bad. And we started doing these maneuvers for about a week with her every day, and also combined it with taking a nervine called valerian. So that has worked for her. It worked for her really well. It went away for a few months and now it's come back. So I'm trying to teach her to do this herself. I think you people can do it yourself. And if you decide to try to use a nervine like valerian, there's a number of them derived from plants. Please get the guidance of an herbalist or a naturopath and make sure they check the counterindications with any medication you're on, okay? So I'm going to walk you through how to do these maneuvers yourself. It's basically acupressure for your face. And any of you that have trigeminal neuralgia will know that where the trigeminal nerve basically goes. So we're going to just be doing maneuvers to relieve the area. No one really knows a lot about the neurology of this. We just know this worked for my mom. So here we go. And while we're doing it, once you practice this a few times, you can just turn it off and put some lovely music on and just relax. This is the one laying down, and then I'm going to do one standing up as well, so that if people want to do it standing up, they can see how to do it that way. So the first thing you do is just take your thumb right here. There's another nerve that moves along your jawline here. We're not going to use any particular big terms. We're just going to move along with what I'm doing. It's not a deep pressure, it's just enough. You know, you'll know. Just a gentle pressure there. Close your eyes, do some deep tummy breathing. Just relaxing. Obviously, you're not going to talk when you're doing this. I will be, and I'm just going to move along really quickly. You stay in any of these as long as you'd like, but you're just going to breathe for a minute here. So you might want to move the gentle pressure over to one side. Leave it there for a little bit. And then the other. I also like to have people do visualizations. So in any of these positions, you can imagine golden light coming through the top of your head, just coming in and relieving the pain, just easing it, and then going out of your body down into the earth, taking the pain with it. Good. And then the second maneuver is you're going to take your hand like this. You're going to gently turn your head, and you're going to just kind of put your fingers at your jawline here, and then you're going to push with your thumb right here. So you're sort of pushing towards the bed. And then you can take your other hand and just gently put it on your head. You don't want to activate any trigeminal neuralgia with my mother. It's activated up here. So, but you can gently lay it there, sort of like a gentle, you know, just a reassurance. And you can put your thumb in back here. You have a number of little tiny muscles back here where your cranium meets your spine, called occipital muscles, and you can just gently, not harshly, just gently either massage them at the same time as you're putting this pressure with your thumb towards the bed, or just leave your hand there, whatever feels best. And keep breathing, big tummy breaths. Because remember, a lot of what's going on, we don't know a lot. The medical community doesn't either about neurological things like this, but what we do know is it's important to relax your nervous system. So all of this is easing your nervous system. So if you can do these and visualize just letting go of any tension, just letting your body let go, that's good. And again, the pressure is not really, really, really huge. It's fairly gentle. So you don't want to be hurting. Anything that's hurting, stop doing it. And then you're going to go to the other side. Exactly the same thing with the other side. You're going to be using your thumb and you're just pushing gently towards the bed, okay, like that. And then again, this hand is right here just for reassurance, maybe a little massaging on these occipital muscles in the back, maybe a little gentle traction pushing up, maybe just relaxing and not doing anything. Just staying there. Again, you're going to stay there for longer than I will in this video. So you just relax and tummy breathe. Now, if your trigeminal neuralgia gets activated, with my mother, the first time we did this with her, the first week, for the first couple of days, it would get activated because it was a new thing. If that happens, stop and just gently put your hands again. Most people get activated up here. Don't press up here. You're pressing in the palms of your hands into your face. If it gets activated, you've got your hands around your ears. And it's sort of a gentle vice. You're just gently pushing in with both hands and breathing. Again, imagining just that beautiful light coming in and just easing the pain, easing the pain. And stay like that until the activation calms down, if that does happen. Good. Then you want to take your thumbs and you want to press right underneath your nose. Again, not too hard, just so you feel it. If anyone's had acupressure done, you know it's just enough to feel it. And you want to breathe in, and just release. And you're just laying your fingers beside your head, breathing in and releasing. Stay there for a minute or two. Good. And then you want to be doing a maneuver here with your hand. So you're actually doing like you did on your chin, but you're doing it here underneath your nose. You're pushing gently, you're pushing. You can either do it that way or you can use your other hand, but I like doing it this way. You're gently pushing towards the bed. And again, you can just lay your hand on your chest or just relax your hand. You can put it over on the other top of your head like this if you feel that's relaxing. And you're just doing a little pressure point, pushing towards the bed. And you're right under your nose, going this way. Breathing. Again, staying away from any activation areas. And then I like to do a little bit of traction. If you have any kind of neck injury, please do not do this, but you're just taking your thumbs in behind and you're not sticking them in. You're just using the flats of your thumbs to just gently do a little traction up. And again, breathing at the very end here, you're just tractioning your head up a little bit, and you might want to do gentle pulses, so up and down and up, and breathing. Breathe up and then let go. And then gently breathe up, let go. What this does is it helps in your spinal column to bring some synovial fluid in between your vertebrae, which we know helps to heal and just relieve nerve pain. So someone else can do this for you too. Sitting behind you, they can gently pull up on your neck. Again, if you have any spinal issues, don't be doing this. Good. You can give it a little massage at the end. Good. And then I like to go here and just relax the eye area, because usually with this trigeminal neuralgia, there's some tearing and your eyes just get really tired. So if you don't have any contacts in, you can also do the massage I'll show you. Otherwise, just do this part, this little pressure point right up here in your occipital area. You're not digging in, you're just using, again, the flats of your fingers, and you're just gently pushing in and breathing gently, 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 gently. And then if you don't have contacts or any eye problems, you can do this. It's actually an ancient method of relaxing the eyes, but you can really gently just give your eyeball a little massage. It weirdly feels really, really good. Breathing, breathing, breathing. Just maybe ending with a little gentle, tiny. If you don't have any activation points here, you can relax your temples a little bit. Again, breathing. You can go to your ears and give them a tiny bit of a massage, a little bit of a tug, little pulling. What this does is we have a lot of little tiny bones in our ears that people never normally pay attention to, and doing this can really release some tension and relax. Just massaging your ears for a minute. Just a nice thing to do. Good. And the very end, you're going to rub your hands together really fast and make them really, really warm. You can have your favorite essential oil, maybe a drop of your favorite essential oil like lavender, and then put it over your eyes. Breathe in. There. I hope it helped.